Addressing the health needs of the community. It's what the Toledo-Lucas County Health Department does day in and day out. And recently, leaders broke down their strategic plan through 2027. Brandon Palinski from the Health Department is with us to go over how these plans aim to help our community. Brandon, thanks for coming in and good to talk to you today. It's nice to have a roadmap because in the post-COVID world which you deal with, okay, that's done. Where do we go from here? Because we have a lot of issues with the community to look forward to. How important was it to get that roadmap together?
It was pretty important. This serves as our rudder. I mean, public health, there's a lot of functions that go on, but without knowing where you want to end up, you can't very well put the initiatives in place to actually reach those goals and reach those targets.
Well, let's go over, there's 5 of them, and chronic disease prevention, of course, that touches everyone. Complete family well-being, healthy homes and spaces, nutrition, a great goal there to try to prevent a lot of stuff, and infrastructure improvement. The building you are in is I'll put it mildly, it's very tired. So let's start with number 1, chronic disease prevention, probably the most important, which affects most people. What plans are in effect? What can you do there?
So when we look at our community health assessment data that we do every 3 years, and we look at some of the program data that we have, and even what our community partners share with us, chronic diseases do impact almost everybody. If you look at obesity rates in the country, I think no one's surprised that they are rising. You can see it everywhere. If you look at hypertension, strokes, heart disease, all of those things factor into not just the people who ultimately succumb to them, but their quality of life as they're growing older and just trying to live their healthiest lives. Chronic diseases, we found, account for almost half of all resident deaths over the past 5 years. So it's a very significant issue, and again, as just the quality of life while you're living with those conditions is also not always optimal.
With health and wellness, for example, the metro parks do a good job of getting people out, a lot of getting outside, walking, doing healthy activities instead of staying indoors. I think a lot of us went down that path during the COVID era when we're kind of in our homes and in our little capsule there, our silo, and now we're getting out and let's go to the second half of our lives and try to more healthy lifestyle. That's a great goal there. Now, complete family well-being, where does that come from?
So complete family well-being centers on focusing on the earliest stages of life and then how our family units are healthy together. Maternal health and infant mortality are huge issues in our county, even our state. Ohio ranks pretty low on the list of infant mortality outcomes. Lucas County within Ohio is also pretty low on the list as far as the outcomes we have. So we focus our efforts in trying to make sure that the infants that are born here are the healthiest they can be. They make it to their first birthday, they make it beyond that. And our focus is really to promote those resources that can help a mother and their family from before birth all the way through and beyond.
Is that a prenatal problem causing this?
It can be. There's a lot of factors that go into it. We have several committees that review those aspects and work to identify the trends, work to put out recommendations for how we can improve those, and really just focusing on how we are preparing the next generation for their healthiest lives.
We have about a minute and a half left, but healthy home and spaces, what does that entail?
So in Toledo and Lucas County, but Toledo especially, we are a Rust Belt state. We have a lot of aging housing stock. We have a lot of issues with lead paint in certain areas. Healthy homes and spaces is an evolution of that. So instead of just focusing on one element of a place where people live, we want to focus on, are there other allergens? Are there other issues impacting the health of the people who live in those particular areas?
Now, nutrition, that is something you think, first of all, kids' nutrition, which is important, but it's adult nutrition as well, because a lot of people cannot afford healthy foods.
So it's affording foods, it's having access to them. There are parts of Lucas County that are in a food desert where people don't live within a mile of a grocery store where they can even access healthy fruits, vegetables, etc. And our focus there also is, do you know how to prepare them? You might not pick up something if you don't know how to cook it, how to prepare it, if it's going to be good or not. So a lot of our focus is making sure there's access and making sure that people know what to do with the food when they get it.
And 30 seconds left here. Infrastructure improvement. Okay, if anyone's ever been inside the health department, The building, you need a new building, let's face it. Is there anything in the works with that at all to try to move that forward?
So our board, our health commissioners have been working with the City of Toledo, the Lucas County Commissioners on locating a new facility. Those talks are still ongoing, but we are hopeful for the future.
Brandon, those are 5 great topics and very, very nice to have a roadmap for the future with the next 3 years. Thanks for coming in today.
Thank you.